Welcome back, everyone. Today, we're doing another deep dive. And this one, well, it tackles a scenario that honestly I hadn't quite grasped the scale of until we look into these sources. Imagine this. You're a federal employee, right? You get injured on the job. You need specialized medical care, maybe an orthopedic surgeon or even a neurosurgeon. But the system that's supposed to help you, the Department of Labor's Office of Workers' Comp, OWCP, it just seems like a dead end. So let's really unpack this today. We're focusing specifically on federal employees, maybe in places like Kansas City or St. Louis. They run into this big problem finding top-notch specialists, the highly rated ones who will actually accept federal workers' comp cases. Many just won't.
Mhm.
It's a huge obstacle when you desperately need care. So our mission here is to cut through some of that complexity. The sources we've looked at offer some really practical solutions, a kind of roadmap, really. They show how injured federal workers can actually get the critical care they need. We're going to pull out the most important nuggets of knowledge, basically shortcut you to being informed on what turns out to be a surprisingly common issue.
It is. It's a very real challenge, and you've really nailed the core issue there.
Yeah.
These information gaps, the bureaucratic hurdles, they have a huge impact on injured workers. It delays treatment, delays recovery. It's tough. What's fascinating, I think, and what we'll explore is that there are these often overlooked ways through the system, and we'll look at the reasons why it's so difficult in the first place, but also give you some concrete strategies.
Okay, so here's where it gets really interesting for me. You're a federal employee, post office, VA, TSA, whatever. You get hurt. You'd think that OWCP coverage means you get access to the care you need. Simple, right? But like you said, in places like Kansas City, St. Louis, these top specialists, they're saying no. Why? I mean, why would good doctors turn away patients who clearly need their help?
Yeah, it seems counterintuitive, doesn't it? But it mostly boils down to administrative burden. The root cause seems to be the, quote, complex documentation and billing requirements that come with OWCP cases. One source put it pretty bluntly. The DLL documentation requirements are time-consuming, so doctors who don't need the extra patients, good doctors generally decline to do it. So even if a doctor has dealt with OWCP before, they might just decide, it's not worth the hassle for a new case. And the consequence, well, is real. Injured workers feel completely stuck. Some, as you mentioned, report having to drive over 100 miles just to find a specialist who will take their case.
Wow. Over 100 miles. That really paints a picture.
It does, and obviously that delays necessary surgeries, it prolongs recovery. It's a serious problem. But, and this is really important, despite all this, you're right, under FECA, that's the Federal Employees Compensation Act, your right to choose your treating physician still stands. That hasn't gone away.
Okay, so the right is there, but the practical access is the hurdle because of the paperwork headaches for doctors. That drive over 100 miles detail. It just shows how bad it can get. So my immediate thought is, all right, if getting a specialist to directly bill OWCP is so hard, what's the most practical workaround? What can you actually do?
Right, so when that direct route seems blocked, the sources point to a really key solution. It's about using your personal health insurance, or maybe even paying out of pocket initially to get that specialist care you need. And then once your OWCP claim is accepted, you get OWCP to reimburse you.
Okay, using your own insurance as a bridge. That sounds like a potential game changer. Is that actually allowed, though? Does the Department of Labor sign off on that?
Yes, absolutely. They explicitly do. The Department of Labor does allow reimbursement for out-of-pocket medical costs related to an accepted workers' comp claim. We even found policy examples confirming this, like from the U.S. Marshals Service. Their policy notes that sometimes medical evaluations are pursued through private medical insurance and reimbursed by OWCP when the claim is accepted. So it's definitely a recognized path.
Okay, that's huge. So how does it work? Can you walk us through the steps?
Sure. Let's break it down. Step 1, and this is foundational, ensure your OWCP claim is filed properly. This means filing the right form promptly, like a CA-1 for a sudden injury, usually within 30 days. And critically, you need strong medical documentation right from the start. Good evidence. This really speeds up getting the claim accepted.
Makes sense. Get the claim right first. What's step 2?
Step 2. Go ahead and get the specialist treatment using your personal insurance. If you can't find a DOL-accepting surgeon easily, schedule with the specialist you need using your FEHB plan or whatever coverage you have. Super important. Tell the specialist it's work-related, even though you're using your insurance initially. And then document everything. Diagnosis, reports from the surgery, and absolutely keep proof of everything you pay. Co-pays, deductibles, the whole bill if you paid it up front.
Okay, so get treated, keep meticulous records. Then what?
Then step 3. Once OWCP accepts your claim, you request reimbursement. you're entitled to get back the money you spent out of pocket for that accepted injury. You do this using Form OWCP.DOCTOR. That's the official claim for medical reimbursement. On that form, you list each service, the date, how much you paid, and you have to attach proof receipts and an itemized bill from the doctor or hospital. Sometimes they use standard forms like a CMS 1500 or UB04 for billing. Attaching those is helpful too.
Got it. Form 915, list everything, attach bills. What else does OWCP need?
Right. Step 4 is providing proof you actually paid and the medical reports. They need evidence you paid those bills. So copies of receipts, maybe canceled checks, credit card statements showing the payment. And you absolutely must include the surgeon's medical report that clearly links the surgery back to the work injury that OWCP accepted. As long as it was necessary for the accepted condition, OWCP reimburses the full allowable amount based on their fee schedule.
Okay, proof of payment, proof it was related to the injury, and
Finally, step 5, track your reimbursement. After you send in the OWCP 915 with all that backup, you can check its status online through the OWCP web bill portal, or you can call their customer service. The sources suggest that reimbursements are processed within a few weeks if all paperwork is in order.
A few weeks. That's not too bad, assuming everything is perfect.
Exactly. And this whole process, this workaround, it raises a key point. The main benefit is that it ensures you don't delay critical treatment just because of OWCP hurdles.
Yeah.
You get the care when you need it. But, and it's a big but, remember OWCP only reimburses for accepted conditions. So getting that initial claim accepted with solid proof, that is absolutely crucial for this whole strategy to work.
That makes total sense, but it does bring up a practical question. You know, if someone's injured, maybe not getting their full pay, how realistic is it to expect them to front potentially thousands for surgery? Even if reimbursement comes in a few weeks, that upfront cost could be a barrier itself. Are there any ways around that part?
Yeah, that's a really fair point. And yeah, the upfront costs can be a significant hurdle for some people. There aren't really specific OWCP programs like advances or anything to cover those initial out-of-pocket costs while you wait for claim acceptance and reimbursement. So the system kind of relies on you having either good insurance that covers most of it up front, leaving you with maybe manageable copays and deductibles, or having the means to cover it temporarily. The speed of reimbursement, once the claim's approved and you file the 915 correctly, is the main thing the system offers. Those few weeks are key. The focus really is on preventing delays in treatment that could lead to worse medical outcomes or longer disability. It's not a perfect financial safety net up front, unfortunately.
Right. So it's a viable path, but maybe not accessible for everyone depending on their financial situation and insurance. Good to know the reality of it. Okay, so using personal insurance is the main workaround. What else? You mentioned other avenues. What if that just doesn't work for someone?
Yeah, there are a few other things you can try. First, you can actually ask OWCP directly for help finding a specialist. Your claims examiner might be able to help. They could have lists of doctors who are enrolled, or they might even refer you to someone in a nearby state if necessary. And here's a critical piece. If OWCP authorizes you to travel for medical care, OWCP will reimburse travel expenses. So if things like mileage, maybe even lodging if it's far, can be claimed, you use Form OWCP 957 for that.
Okay, so lean on the claims examiner and know that travel costs might be covered if OWCP sends you elsewhere. What else?
Another approach is to try and encourage a local specialist, maybe one you already know or trust, to actually enroll or at least agree to treat you for this one instance. If a surgeon is hesitant, maybe because they're unfamiliar with OWCP, sometimes having your case manager reach out can make a difference. If they understand the claim is already accepted, and maybe someone else can help with the specific billing nuances, they might agree. We heard about cases where a case manager explained the situation, clarified the billing wouldn't be a nightmare, and the doctor agreed to do the surgery. Sometimes even a one-time agreement can be worked out. As the saying goes, it never hurts to ask. The worst they can say is no.
Interesting. So a bit of proactive communication and reassurance might sway a hesitant doctor.
It can, yeah. And then there's the last option, which is generally less ideal. Delay the surgery until OWCP officially authorizes it if it's medically safe to wait. This really only works if your condition isn't urgent or rapidly getting worse. In the meantime, OWCP would likely cover conservative treatments, physical therapy, maybe medication, that kind of thing. But honestly, the sources are pretty clear that most federal workers prefer not to put off a needed operation for too long. Understandably, right? It can just prolong pain and disability.
Yeah, waiting while you're in pain doesn't sound appealing.
Definitely not. So across all these options, the advice often comes back to consulting with someone who really knows the system, a federal workers' comp specialist or a dedicated case manager. They can help figure out the best path for your specific situation. Remember, you have the right to choose your doctor, but you also have that responsibility for making sure everything's reported correctly and justified.
Okay, these options make sense on paper. Ask OWCP, try to persuade a doctor, wait if you can, use your own insurance. But putting them into practice, especially when you're injured and stressed, it sounds like a lot. You mentioned case managers. Our sources pointed to organizations like Restore Muscle and Joint in the Kansas City and St. Louis areas that seem specifically designed to help with this. How do they fit in?
Exactly. That's where specialized support becomes so valuable. These places aim to be a one-stop solution, really. They typically offer expert OWCP case management. They have people on staff, DOL credentialed doctors and OWCP forms experts who live and breathe this stuff. They handle all the required paperwork, filing your initial claim, the CA1 or CA2, making sure your injury is properly documented, submitting all the medical reports to OWCP. Our sources stress that these groups often excel at approvals because they know exactly what OWCP needs to see.
So they handle the bureaucratic headache right from the start.
Pretty much. They also focus intensely on ensuring complete documentation. This is huge. So many claims get delayed or denied because of missing information or reports that aren't quite right. These teams make sure everything meets the standards. They write strong medical narratives, reports that clearly explain how your condition is work-related, and they gather all the supporting evidence, like accident reports or diagnostic test results.
And what about actually finding that elusive specialist?
That's another key role, referral coordination. They actively work to find a surgeon who can take your case. And they don't just give you a name, they actively coordinate with the specialist's office about billing and approval. Even if you end up using your private insurance route we discussed, they'll still liaise with that surgeon's office. They get the operative reports, the billing details, everything needed for your OWCP reimbursement claim later. They really aim to guide you through every step.
Okay, so they manage the claim, the documents, and help coordinate with the actual surgeons. What about the money side, the reimbursements and wage loss?
Yep. They handle the paperwork for reimbursements and claims, too. They make sure you have all the proper paperwork and documentation needed for that OWCP 915 medical reimbursement form and the OWCP 957 for travel, if that applies. Plus, the CA7 forms you need to file to claim wage loss benefits if you're unable to work. Essentially, many offer this as free, expert OWCP claims assistance alongside the medical care they provide.
Yep.
The idea is you focus on getting better. They handle the OWCP maze.
That sounds incredibly helpful, full-service approach. But let's say for a listener maybe thinking, okay, I might want to try handling this myself first, or maybe they aren't near one of these specific clinics. What are the absolute rock-bottom essential things they need to get right if they're navigating this solo?
That's a great question. If you're going it alone, the non-negotiables are, number one, meticulous, almost obsessive documentation. Keep copies of everything, every bill, every report, every letter, every phone call log with OWCP, everything. Number two, timely and accurate filing of those initial claim forms, the CA1 or CA2. Getting that right sets the stage. Number three, really understand the reimbursement process if you go the out-of-pocket route. Know the OWCP 915 form inside and out, and be prepared to provide crystal clear proof of payment and medical necessity. No ambiguity. And number four, persistence. You have to be prepared for persistent follow-up with OWCP, with your doctor's billing office. Stay on top of it. It's definitely more legwork. But mastering those four things is crucial.
Meticulous records, timely filing, understand reimbursement, persistent follow-up. Got it. That really clarifies the DIY essentials.
Right. And just to round out what these support organizations do, they also provide continuous follow-up and support. Their case managers watch the timeline like hawks. They know the deadlines for continuation of pay. That's copy, where your agency keeps paying your salary for up to 45 days and for filing wage loss claims. This proactive approach helps ensure no gaps in your benefits or delays in payment. Think okay. They act as the central coordinator between you, the specialists, OWCP, and your employing agency. They keep all the pieces moving together throughout your entire recovery.
Okay, let's try to put this all together now. Let's map it out. What does this journey actually look like chronologically for an injured federal worker? From day one of the injury through maybe getting that specialist surgery using insurance and finally getting reimbursed. It sounds like you almost need a project manager certification just to get your injury treated, which I guess really highlights why these support clinics exist.
It can definitely feel like managing a complex project, you're right. Okay, so here's a typical timeline setting some expectations. Day zero, the injury happens. First thing, report it to your supervisor. Then, seek initial medical care. If you're in an area like KC or St. Louis with a dedicated clinic, like Restore, you might go there. They'd start the exam and initiate the OWCP claim, usually a CA1 for traumatic injury or a CA2 for occupational disease.
Okay, report, get initial care, start the claim. What happens in the first week?
Week 1 is typically your initial OWCP medical visit. This is more thorough. Comprehensive exam, diagnosis, maybe starting some conservative treatment like therapy. The doctor focuses heavily on documenting how the injury is work-related. That causation piece is key. If it's clear you need a specialist, like an orthopedic surgeon, that referral gets noted right away. They might also request a CA16 form from your agency. That authorizes payment for initial treatment, kind of guarantees the first bills get paid quickly.
All right, initial exam, documentation, maybe a CA16. Then OWCP looks at it.
Exactly. Weeks 2-4 are usually when OWCP claim adjudication happens. The claim examiner reviews all the submitted paperwork. If the documentation is strong, especially for a clear traumatic injury, there's a good chance of acceptance relatively quickly. Now, if your condition is urgent, say, something serious needing immediate surgery, the support team wouldn't just wait. They'd likely help you schedule that specialist consult using your personal insurance while simultaneously pushing OWCP for claim acceptance.
So things can happen in parallel if needed. What about getting the actual surgery done?
Right. So by week 4-6, you might be having that specialist consultation and potentially the surgery itself. If you've gone the route of using your personal insurance because finding an OWCP surgeon was taking too long or wasn't possible, this is when it happens. You'll likely pay your deductible, co-pays, maybe more, out of pocket. And you keep feeding all the information, surgical reports, diagnoses back to your case manager or support team.
Okay, surgery happens, paid potentially out of pocket. When does OWCP officially step in?
Hopefully around week 4 to 8, you get the good news. Claim accepted. OWCP issues a formal decision accepting your claim for the specific diagnosed condition. This is huge. It means all future-related medical care is covered directly by OWCP. And crucially, if you already had that surgery using your own insurance, now the path is clear for retroactive reimbursement. OWCP is now officially on the hook for those costs.
That acceptance letter sounds like gold, so then you file for reimbursement.
Exactly. By week 8-10, it's time for the reimbursement filing. Your support team, or you if you're doing it solo, compiles that OWCP 95 form we talked about. They attach all the proof, the surgeon's operative notes, the itemized hospital and doctor bills, proof you paid those bills. This whole package gets submitted to the OWCP Central Bill Processing Center, which is actually in London, Kentucky. If you had travel expenses authorized, the OWCP 957 goes in too.
Okay, paperwork submitted to Kentucky, then you wait for the check.
Pretty much. From week 12 onwards, it's about follow-up care and payment. You'll likely be doing post-operative rehab or physical therapy, which, now that the claim is accepted, OWCP should be covering directly. Your support clinic might even provide this. Meanwhile, OWCP processes your reimbursement claim, the 915. If everything is correct, they issue the payment to you. You're also likely filing CA7 forms during this time if you're still off work, claiming compensation for lost wages. Ideally, at the end of this part of the process, you should have no out-of-pocket losses for the medical care related to your accepted injury.
That's the goal, no out-of-pocket losses. What about long-term?
Long-term, the case either moves towards closure or might continue if you have ongoing issues. Your support team, if you're using one, stays involved. They provide regular progress reports to OWCP as required. They help with navigating return-to-work efforts or getting an impairment rating if you have permanent limitations. They help resolve any disputes that might pop up. As one source put it, their support doesn't end until your case is fully resolved.
Okay, that timeline really clarifies the journey. It's complex, definitely requires patience and organization. So let's try to boil this down. The core message from this deep dive seems to be, yes, facing a lack of local specialists willing to take OWCP for your federal work injury is a real problem. It can feel overwhelming. But as we've uncovered, there are effective solutions. You don't just have to give up or suffer.
Exactly.
And the key takeaway, the main strategy, seems to be this. Using your own personal health insurance to get timely specialist care and then diligently pursuing reimbursement from OWCP once your claim is accepted. It's a documented, viable path. But, and this is the other big piece, success hinges on having really strong guidance and absolutely meticulous documentation throughout, which brings us back to the role of dedicated support, those expert federal workers' comp clinics, like the example Restore Muscle and Joint in KC in St. Louis. They really act as that essential guiding hand through the maze.
That's right. Because, knowledge is great, but it's most valuable when you can actually understand it and apply it effectively. So for you, the listener, remember, you absolutely have the right to quality medical treatment for your work injuries. That's fundamental. Even if you hit that initial wall where a surgeon says they won't take DOL, That doesn't mean you're out of options, doesn't mean you go without care. With the right strategy, maybe using that insurance bridge, maybe with help from a dedicated clinic, you can get the treatment you need and ultimately have OWCP cover the cost as intended. So, don't get discouraged by those first roadblocks. There's almost always a way forward. If we kind of connect this back to the bigger picture, it's really about empowering you, the individual, to navigate these complex systems that can often feel designed to be confusing.
That's a great way to put it, empowering you to navigate the complexity. So, this deep dive has really unpacked the surprising and sometimes frustrating reality of getting specialized care under federal workers' comp when local options are scarce. And it leaves me with a final thought for you to consider. In a world that feels increasingly full of complex systems, regulations, just information overload, how much is our ability to actually access what we need, whether it's healthcare benefits or something else? How much does that truly depend on knowing the secret pathways, the workarounds, and maybe, just maybe, having the right guide to show you the way? Something to think about. Until next time, keep digging, keep learning, and keep asking those big